Hello, in this video we're going to talk about if it's necessary to prepare the breast for breastfeeding. The answer to that is no, not really. The best preparation that you can do when you're breastfeeding, when you're pregnant, is to actually talk to some friends that have breastfed, talk to your healthcare provider about breastfeeding, and also watch some videos and get as much information as you can about breastfeeding. Breastfeeding is natural, but it's not naturally easy. Breastfeeding is an art. It's something that you and your baby have to learn to do together. Maybe since you've been pregnant, you've noticed some changes in your breast. Maybe you've noticed that the nipple has become more sensitive. Maybe you noticed that the brown part around the nipple, called the areola, has gotten darker and it's gotten bigger. You may notice that your breasts have more veins in them. All this is a good sign that your breasts are preparing for breastfeeding. So some ladies worry about the size of their breast and they think because the breast is small, they won't have enough breast milk. This is really not true at all. A small breast and a large breast will produce the same amount of milk in 24 hours. If your breast is small, however, maybe your baby will want to breastfeed more often. If you've had a surgery on your breast, you've either made them bigger or smaller, you can absolutely breastfeed. There's no question about that. Whether you'll be able to breastfeed exclusively, that we're not going to be able to know until the baby's born. Because when a doctor does either a breast augmentation or reduction, they may have made an incision around the areola, which is where the milk ejection nerve comes in. So we really need to keep an eye on baby's stools and baby's urine and baby's weight gain. Before considering any aesthetic surgery on the breast or on the nipple, talk to your doctor beforehand about the possibility about breastfeeding later on. Your baby will adapt to the type of nipple that you have. Some of us have nipples that stick out quite well. Some of us have a nipple that's a little bit flat, and some of us even have a nipple that's inverted, a little bit like this one here. And you will be able to breastfeed. If your nipple is flat or inverted, you might need to use a pump to bring out the nipple, or maybe a lactation consultant may recommend that you actually use a nipple shield. And we do have a video on correct use of nipple shields. So all in all, no preparation necessary.